Okay, good morning, doctors. Welcome to Filling Your Office with Grateful Headache Patients. Just doing a sound check first thing this morning just to make sure everybody can hear me. So if you would just if anybody would enter into the question box, just yes, I can hear you. Well, I'll get started right away. Okay, great. Sounds great. Perfect. All right, doctors. First of all, welcome. Good morning to those of you who are new to Spinal Kinetics. We do webinars twice a month, and I try to bring real pertinent information. This morning, information is probably, I don't know if it gets any more pertinent. My name is Dr. Cronk. I'm with Spinal Kinetics, and we're the largest national testing service for ligament injuries for doctors of chiropractic, for doctors of osteopathy, for medical providers across the country. So what I want to talk about is the applicability of this type of information to your office, and particularly we're going to talk this morning about headache patients, right? So with no further ado, let's get started. First of all, what I'm going to do when I talk about headaches, I'm going to talk about the worst kind of headache there is, which is migraine headaches. And this is really well known today to be a seriously disabling condition. It affects 38 million men, women, and children, and that's a lot of people, obviously. So migraine remains, and when I say migraine, again, when I say migraine, I could just dub that in headaches. Headaches in general, or migraines, remain poorly understood disease that often undiagnosed and undertreated. Now, this is what makes for a huge opportunity, a market opportunity, for anyone who specializes in what causes this condition. So everyone either knows someone who suffers from migraine or struggles with migraines themselves. So a lot of doctors ask me a lot of times, how do I get new patients? How do I get new patients? How do I get new patients? Well, lumbar pain is the #1 cause of pain and disability in the world today. 30% of the American population experiences low back problems within the last 3 months. Neck is the same. It's the #4 cause of pain and disability in the world. And now today we're going to talk about headaches, which is the 6th leading condition. So if you specialize in low back problems or neck problems or headaches, which are neck problems, they're everywhere. The patients are everywhere. So today, again, we're talking about migraine, which is the 3rd most prevalent illness in the world. It's the 6th leading cause of disability. Nearly 1 in 4 U.S. households include someone with a migraine. So if you drive by 1,000 houses today, there are 250 houses that you drive by that has a chronic migraine headache sufferer in it. So you know, it's very easy. There's no lack of patients here. None. So most doctors don't realize how serious and incapacitating migraines can actually be. They really don't. And we're just going to put down the sound here on this phone. And that's the part that I want to talk about today. Let's talk about that. So in order to address a condition, you have to understand it, right? So every 10 seconds in the U.S., somebody goes into an emergency room due to migraine headaches. Every 10 seconds. While most sufferers experience attacks once or twice a month, more than 4 million people have chronic daily migraines with at least 15 migraine days per month. Full days that they have migraine headaches. More than 90% of these sufferers are unable to go to work or function normally during their migraine. Now, this is work. What about social function? You know, let's talk about what a migraine headache sufferer really goes through. I mean, it's extremely incapacitating. Typically, there's a severe throbbing and recurring pain, usually on one side of the head, but with 1/3 of the attacks being both sides of the heads. They're usually accompanied by more disabling symptoms: visual disturbances, nausea, vomiting, dizziness, extreme sensitivity to sound, light. This is the patient that has this condition. I mean, how would you like to be a patient who every time they had a migraine headache, they knew they were going to vomit? And so socially they have to retract because 15 days out of the month they can't really be involved in their normal activities. This is the level, doctors, of this patient that I'm talking about, right? Now, if you had that condition, what would you do to get rid of it? What would be the first thing you would have to do in order to get rid of it? You'd have to find a doctor. And you'd have to find a doctor that understood it. That's what we're talking about here today, right? Now, there should be, on this call today, there should probably be 1,000 doctors on this call today, right? Because this is a simple, not a particularly difficult condition to manage and in some cases completely alleviate. So, you know, these patients actually have severe symptoms associated. Now, it definitely diminishes their quality of life, right? And that it diminishes their quality of life because they basically have 4 million people of them, of the 38 million, 4 million have daily. Medication use is definitely a problem. So the main medical solution for this is not a solution at all. Depression, anxiety, sleep disturbances are common with those with chronic migraines, right? We talked about injury work before, and I've said, gosh, in injury work, the most common reason for a migraine headache is injury to the cranial cervical junction and the upper cervical ligaments. I'll show it to you. And so when you have this in the acute stage and you also have headaches and you have loss of sleep, you have severe loss of healing capability, significant loss of the ability because the patient's not getting enough sleep. So they're losing their regenerative and recuperative powers. Now, migraines affect kids also. I just want to go over this part. About 10% of school-age children suffer from migraines, 1 in 10. Half of them have their first attack before age 12. So you say, well, what causes that? It's the same. What causes it is an injury. The original thing that causes it is a trauma. Now, can there be other things that cause it? Can there be hormonal imbalances? Yes, but what you're going to focus on is the thing that you focus on anyway, which is misalignment. Migraines, it definitely a serious problem. And here's the big problem, right? And here's where you can seriously cause somebody to, you know, when you think about the impact that you can have on a person or a family's life that actually has this condition, right, is the household that has this condition has a 70% increase in expenses per year for the migraine headache sufferer. So that's significant. These families also suffer a lot of additional costs. So they get no results and a lot more costs. Now, can you change that? Well, that's what we're talking about this morning, right? Migraine headaches remain poorly understood disease that is often undiagnosed and undertreated. That's the other fact of this condition, right? So that's I'm going to turn off this phone right now. That's the other fact of this condition. Now, in 2017, there was 500 certified headache medical specialists. Now remember, a medical specialist is going to do what? Are they going to diagnose the ligament injury? No. Are they going to diagnose the misalignment? No. Are they going to diagnose the cranial cervical junction problem? No. Are they going to diagnose the upper cervical problem? No. What are they going to do? They're going to diagnose that the patient has migraines and then put them on a medicine, on a medication generally, right? So more than half the migraine sufferers are never diagnosed, and they're never diagnosed because that's what they know they're walking into. Even though they have headaches 15 days out of the month, even though they're throwing up, they're vomiting, they're getting dizzy, they have visual disturbances, they know that the alternative to this is really not a solution, or they've tried it and it doesn't work for them. So what is the key? Well, the key to resolving any condition is getting an accurate diagnosis of what's causing it. Right? So diagnosis means the identification of the nature of an illness or other problems by examination of the symptoms. Now, nature is an interesting word here. Nature means physical phenomena. Anything in nature is physical. It's identifiable. Right? So the nature of the condition is the physical cause of the condition. You examine the symptoms, and then you work backwards and say, well, what's the cause? That's what diagnosis is, and that's what a diagnostician does. So on this morning, all I'm talking about is making you significantly up your game in professionalism for your ability to diagnose things. Now, all headache patients have a very common treatable physical problem, which is diagnosed with a simple, inexpensive X-ray test. So let's talk about that. First of all, whenever we're using diagnosis today, if we're going to be very professional in our diagnosis, we want objectivity to enter into it. That means we want to identify a biomarker that indicates a specific condition or state is occurring in the body. These are called today biomarkers. So if we have a high blood sugar glucose level, fasting glucose level, we know we have diabetes. We use that as a biomarker. If we have an HIV antibody, we know that we use that as a biomarker for HIV. Every condition pretty much today, except for mental conditions, have biomarkers. They're actual physical things that we're testing for in order to identify it, if it can be the cause, and if then that cause becomes the diagnosis. Now, we also have things called imaging biomarkers. And imaging biomarkers are the same thing. It's a biological feature or a biomarker detectable in an image. And an imaging biomarker is a feature of an image relevant to a patient's diagnosis. And remember, what was diagnosis? The physical cause of the condition. So we know, if I go to the American Association of Neurological Surgeons today, it says occipital neuralgia. Every doctor on this call today knows what occipital neuralgia is. There's 3 occipital nerves, really 2. C1, C2, and some have called the 3rd cervical nerve as the lesser occipital nerve. Right? So those 3 are the main cause of headaches. Where does cervical 1 come out? Well, it comes out between atlas and occiput. Where does cervical 2 come out? Between atlas and axis. Where does C3 come out? Between C2 and C3. Those are where those 3 nerves come out. Okay, now what can interfere with those nerves? Well, the only way that those nerves stay uninterfered with is if all of the ligaments that hold the structure in perfect alignment are actually in perfect condition. Now, if any of those ligaments are impaired, remember the head is held to the body with ligaments. There is no bone that attaches your skull to your body. It's attached by ligaments. They're called the cranial cervical junction ligaments. They're very important. They're very critical. And if they are damaged in any way, which they oftentimes get damaged in auto accidents and work-related injuries, in sports injuries, and domestic violence injuries, and war injuries, anywhere where you can have a shear force or compressive force into the spine, and that mechanism delivers that force, it can injure that area. We know that today. So occipital neuralgia is known as is a common cause of headaches. It involves the occipital nerves. Right? Now it also says, hey, this can be due to tumors, infections, systemic disease, hemorrhage. Those are normally not the cause. Now what is the cause? It says right there, trauma. Now does the trauma have to be current? Well, if it's acute trauma, yes. I never had headaches. I was in an auto accident 3 days ago, and man, I'm getting these amazing headaches. Oh, then you have an acute situation now. But what about the patient that says, I don't know, I've got these headaches, they've come on, they just seem to gradually have come on. Okay, if you were to take a history of that patient, if you could watch film of that patient's life, I will guarantee you 1,000% they have had serious incidents of impact into the areas that would cause the ligaments to be damaged and therefore misalignment of the area and loss of function to that area. That's what they have. Now, we know that in trauma of any kind, the spine deranges. And if we actually have excessive motion as a derangement pattern, in other words, we can damage the ligaments and it causes excessive motion, which causes misalignment of the spine, misalignment in both position and movement. Now, if that misalignment in position or movement interferes with a nerve, it's called a spinal subluxation. If it interferes with a nerve, it's also called a spinal instability. They're identical. They're the exact same term. Now, we also can have a disc herniation. That's one of the ligaments, right? There's only 23 discs. There's over 220 specialized ligaments. And that's why MRI in these conditions is really quite patently deficient, because it only reports on the discs. It doesn't report on the cranial cervical junction, and it doesn't report on excessive motion, and it doesn't report on any other ligament except for the disc. So if you think you're going to become an expert in the imaging biomarkers with just MRI, patently deficient. Now, it's very, very good, but as I'll show you, but we have to remember that the cranial cervical junction doesn't have a disc in it, right? So we can take these problems, these imaging biomarkers, and now they cause symptoms, right? Because remember, diagnosis is the symptom, reverse back, look for the cause. And there are common causes. The most common cause of these symptoms is a ligament problem. Totally, 100%. Spinal instability is the most common cause. And a spinal instability is a ligament problem that is causing now a clinical scenario to occur in the patient. It doesn't get any easier than this. So now you take this patient in, right? Now you become the specialist for headaches, right? There's only 500 medical across the United States. How many are needed? Oh my gosh. 1 in 4 households you're going to drive by has a patient that may be potentially throwing up on a regular basis due to a headache that hasn't been diagnosed, that could be properly handled in your own clinic. You got to think like that. So they come into yours, they do a neurology headache questionnaire, whatever you're putting them through to ask them about the questions. You're starting to think already about spinal instability. Where? In the upper cervical spine. You're doing an examination procedure. You're already starting to do sensory. You're testing the C2. You're testing C3. You're testing C4. You're testing the motor for C1, motor for C2, motor for C3. You're starting to test these things, right? Now what are you going to do? You're going to put the patient through an appropriate amount of stress radiology to stress the area of concern. What's your area of concern? It's the upper cervical spine. So then you send out for a proper excessive motion study. And the test comes back, which is exactly what Spinal Kinetics is all about. The test comes back, okay, your C2 motion unit, C2 on C3 is tore up. And at the same time, you've got significant, now we could have even more significant here. I could have an atlas lateral shift of 4 millimeters or 3 millimeters. You have atlas lateral shift on C2, C1, C2. The ligaments in the cranial cervical junction are showing significant problems. Well, what do you actually have? Well, you had at some point a misalignment of the upper cervical spine. Now, it's a pretty important area because a lot of neurology flows through there. And so we have this really extensive ligament system called the cranial cervical junction ligaments. They're damaged. It's very easy to pick them up on imaging. What's the most common symptom for that? Headaches. So these are the symptoms with a cranial cervical junction problem. Memory problems, migraine headaches, neck pain, recurrent disturbed vision, severe fatigue, sinus congestion, tinnitus, vertigo, Okay, ear pain, facial pain. So patient has a migraine headache, right? They also have experienced vertigo. They experience dizziness. They experience exactly what this is saying are common to their experience. Now they have to find a doctor that can diagnose it, and one that actually has the confidence to know exactly what is on a more probable than not basis going on with the patient. Now, can you do that? I believe you can, but we also have this degeneration of imaging, both in medicine and in chiropractic, where so many offices today they don't even know what imaging biomarker to look for, so everything in their office is subjective. We're trying to increase the professionalism here, doctors. And I'm so proud of the staff of Spinal Kinetics, because we sit in here all day long and that's what we're doing. We're upping the professionalism of the doctor's ability to diagnose conditions that commonly affect people. And the better that the doctor understands the condition and can appropriately diagnose it, the better that you can actually treat the patient. Now, I wrote a report on the 3 biggest pitfalls with MRI and spinal ligament injury diagnosis. We just changed a landing page where you can download this report. Hopefully it's fixed. If it's not fixed, you may have issues with downloading the report, but it's at www.smartinjuryradiology.com. If there's any problems with that, you just call Spinal Kinetics at 877-508-9729, and you can get a free copy of this report. It explains extensively and very simply how this information is not picked up on an MRI, not in general. So I am the Director of Education for Spinal Kinetics. The program that you're seeing today is for Spinal Kinetics. These reports I write for a company I have called American Spinal Injury and Impairment Consultants. Spinal Kinetics is an imaging company. It's not an educational company. We assume that the doctors that use us know what they're doing when they use us. Now, we put on programs like this so you can see how what we do at Spinal Kinetics affects your ability in all your areas of private practice, not just your injury areas. So Spinal Kinetics as a company is an imaging company. Yes, we do have some back office videos and things that we do to help you understand our paperwork, our documents, how to submit studies, things like that. But for me to be able to teach people and be able to help them not so much build their practice, but be able to communicate out to their communities what makes them unique. I have another company, and that company is American Spinal Injury and Impairment Consultants, and I have a program where we have marketing packages for doctors, like insanely inexpensive, that allows the doctor to start to specialize in this area of ligament injury. Again, lumbar, 30% of the people in the last 3 months, 30%, so 1 in 3 people of everybody you've met and seen in the last week has had low back pain. Same with neck pain. 38 million have migraine headaches. 1 in 4 households. This market is so large and it's so easy to penetrate. That's why I created American Spinal Injury and Impairment Consultants as an educational program to help doctors and educate them on how easy it is to go and penetrate this market. That information is at smartinjuryeducation.com, right? So the road to recovery for these patients is just a phone call away to your office, right? So it's very easy to actually, once you understand what you're doing and how to diagnose these things, then you have to message out to your community what makes you unique. You have to message to your local medical doctors you realize the local medical doctors in your community don't like treating these headache patients because they actually don't get very good results with them. They don't know what to do with the injury patients because they don't get very good results with them either, right? So it's very easy to go out and get patients from your local medical community, from your local legal community, your attorneys. It's very easy to go direct to patients, to groups, to explain what makes your clinics unique in this area. Today it's like unbelievably simple. So twice a month, I either bring a content person in now to talk about ligaments and ligament injuries and things like that, or I do a program on the applicability of this type of information to your private practices. And so this morning, that's my conclusion to the program that I've done for headaches. Always in these, I do a question and answer session where I'll answer any questions that anybody has on this particular issue. This is the easiest thing. I mean, you could build a huge, huge clinic and all you did is handle headaches. Now, I'm going to tell you right now, you're a trauma clinic. You're handling trauma that caused the headaches. So all clinics have to understand and learn trauma, right? Because that's what's causing the issue there. So now we're at question and answers, doctors, and I don't want to take up any more time. Usually I try to run these to about 25 or 30 minutes, so they're very quick and right to the point now. And now it's time for you to give me any questions that you might have regarding headaches, regarding what you can do with this type of information. You remember, the biggest thing with these patients is they're not diagnosed. And having a person come in and say, well, look, I vomit when I headache and I get visual disturbances and I go through this aura, everyone goes, what? What do you call that? Migraine headaches. Good. So that's like the person coming in and saying, well, I have neck pain. Well, good. You got this condition. It's even codable called cervicalgia, but that's not a diagnosis. Migraine headaches is not the cause of migraine headaches. So migraine headache as a diagnosis is not the diagnosis. And the majority of people that go in today with migraine headaches come out with a diagnosis of migraine headaches. That's not the cause of it. And today, I know that, like I'm looking at the list right here today, I know that I have medical doctors on board today. And I know that those medical doctors, some of which are actually working with PRP, they're working with stem cells, they're working with injections into the areas of spinal instabilities, and they're starting to see good results with it. Now, spinal adjusting, because of what it does for the spinal ligament injury and how it brings the mechanoreceptors back online, is the #1 modality in the world for this condition. Now, you add PRP, you add stem cells, you add prolotherapy to this. I mean, the world is perfect as far as that patient for the highest opportunity to get a result with these conditions. So this is not just chiropractors anymore. This is chiropractors. This is medical doctors. This is the integration of the actual modalities that do the best for this condition. And that's what we're doing at Spinal Kinetics. We're bringing those all together. But we're making it very easy, one, to get the diagnosis. And why do we want to do that? Because we want to reduce the cost for these people. Right? If you knock out migraine headaches, I just showed you, according to the Migraine Research Foundation, you knock out 70%. You can reduce their medical costs next year by 70%. Now, questions. Either you just type in a question in the question box. Okay, great program. Thank you so much. Yeah, you're very welcome. Wow, never seen this much information this well put together. Thank you very much. I appreciate it. Now, go ahead and ask me if you have any questions. If you don't, then I'll know that I don't want to take up more of your time. You are doctors. You're very, very busy, and I understand that. So I will only want to keep you if there are some questions. And if you'll just ask questions, every doctor on the line today benefits from those questions. They're that easy. So are you saying, okay, here's a question. So are you saying that spinal instability is the main cause of this condition? Yeah, 100%. 100%. And what I'm saying is if you identify it and then you start to treat it and you will start to see 100% of what I'm saying. Now, can there be other factors? Yes, there can be. Yes, there can be. Let's say you have Now, a migraine headache sufferer that for the last 12 years has gone very inactive and they're obese. Okay, now that can cause a condition called metabolic syndrome. So now not only did you have an injury, you had it undiagnosed, the patient's not actually doing well, so for 12 years they've increased their weight, and now they've got metabolic syndrome, which can be an overall body high inflammatory condition. Now, you're sitting there going, well, I'm going to adjust this 3 times a week, and I'm not getting the changes I want. You may need to do what? Get the overall body inflammation down, which means what? Weight loss. It's not the fact that the condition was wrong. Your condition is right. It's what you treat now, what you have to do. You have to start to think with this and in treatment, right? And you have to reduce the factors now that are causing the condition to stay in place. And there can be a lot of different factors. Okay, so sounds great. This sounds great. All right, so here's a question. Did you have success with strength rehab in your office in conjunction with upper cervical instability? Yes, but with upper cervical instability, the strength gain that we did, anytime you can improve the strength around the joints, it helps. So we used head weights. We used traction and head weights in order to do that. And I did a research, I did a program, I don't know, a couple months ago, where I told you I participated back in the early 2000s with some of the original head weight research on that rehabilitation. And yes, it helps significantly. Tell me more about your marketing package and cost and further details. You just go out to smartinjuryeducation.com. It talks all about it. It's $97 a month, and this is not the program for me to talk about. It's $97 a month. There's an educational side for the clinical, and then every month we deliver marketing pieces to you. And you stay as long as you want to. Now, that program will probably last at $97 a month. I'm already looking at it. Within a month, it'll probably be a $997 to a $1997 program that you'll have to pay up front. Because there's that much. Right now, you can go into it for $97. You can stay a month, stay 2 months, and get out of there, right? Well, there's too much information. There's too much value there. So that'll change. But you just go out to Smart Injury Education, and there's some videos on that. And again, it's www.smartinjuryeducation.com. Okay, what if the patient's currently being treated with a medical doctor and they're on a stiff medication? Will that influence their treatment? It can. It can. But that's where you want to get in communication with the local medical doctor that's treating the patient, right? Because here's the thing, guys. And when I say guys, I use doctors. I have males and females on the line this morning. You want to engage in your local community of doctors, and you want to start to become not lone rangers. You want to start to become very extroverted in your ability to communicate these things to your local doctors, because your local doctors will work with you. And if that local doctor gets a result with one of his migraine headache patients, he's going to send a lot to you, or she's going to send a lot to you, right? Because they don't get great results with what they're currently doing. So it's very easy to start to develop relationships, but you got to communicate. You got to have something very logical to communicate, because I'll tell you what, the medical providers in the United States are some of the smartest people. They're some of the smartest professionals in the market today. I mean, these are very, very smart people. So if you approach them with objective research and very logical approach, which we teach, it's very easy. Like I said, go get the report on MRI, and you'll start to see exactly what I'm talking about, how the MRI is deficient, and the MRI is what they used. Right? Well, it doesn't tell you. It doesn't tell you much, especially for the headache patient. It doesn't tell you hardly anything at all. So, it's just not that difficult. Okay, I'm slowing on questions. Again, I don't want to keep you any longer than we have to. I will answer questions until there is no further questions. Try to log, like I said, I put together pertinent information. We'll do twice a month. This is for Spinal Kinetics. This isn't for American Spinal Injury and Impairment Consultants, but this is just, these are just programs where I talk about the relevance of it. It would be very easy in your local communities to be taking 20, 30, 40, 50, 60 new headache patients a month, just based on what I just told you. The headache patient needs a diagnosis, and if you can diagnose the condition, you're halfway home to seriously changing that patient's life. And a patient that is throwing up 15 days out of the week or 15 days out of the month, who can't work, who actually has somebody who removes their migraine headache, well, guess what? What's their reality? What's your reality? You relate to and associate with people that have a reality with you. These people know a lot of other people that have headache problems. Your referral rush can be quite significant. So that's what I'm going to end with, doctors, and I very much so appreciate your time. Always these programs will be short, right to the point. Have a great rest of the week. I hope this has somehow helped you. As soon as that next headache patient walks in this afternoon, I want you to think with, this is a cranial cervical junction ligament or upper cervical ligament problem. It's causing a spinal instability, which is causing the symptom of the headaches. Doctors, thank you very much for your time.